Hello again, this is Dr. Anthony Rakovic at Euclid Chiropractic Clinic in Upland. What I want to talk about today is scoliosis. What is it and why it's important to get your child checked? First of all, scoliosis is this picture here. This is a picture of a scoliosis spine where it has the S-shaped curve and start developing, which is a concern for parents, anywhere from 4 to 5 years old and anywhere from 2nd or 3rd grade. Two reasons for scoliosis is one is genetic, coming from parents, such as a parent has scoliosis, mother or father, or a relative too. Anywhere from that gene pool can cause scoliosis in that overall child. Second reason is functional. Functional meaning coming from something that they're dealing with in their physical environment, meaning sitting in a classroom 4 to 5 hours a day, such as most kids do, carrying heavier backpacks than their body can handle, such as most kids do, even playing sports causing injury from that. So our job is look at scoliosis here again and see exactly how do we correct that and what the reason is for that. The difficulty is most schools will recommend getting checked and getting screened in the school from 7th and 8th grade. Again, we talked about it developing 4 to 5 years old. That's going to be way too late. That's almost 5 years too late. The problem is if they detect it then in the screening in high school, at that point they'll send them to the medical doctor, which will wait and observe and see until they require bracing, which again, and I can show you research on that too, it's not very effective. From the bracing, what happens is that develops further and further. Then the child may require surgery. And any parent, as a parent myself, does not want the child to have surgery unless they really need that. What happens is, nationally, the National Scoliosis Foundation has shown over every year 30,000 children are given braces for scoliosis, and 38,000 children are given scoliosis surgery because it can't be corrected from the bracing. The problem with the surgery portion, going down the medical route again, is as you can see from these results here, is that it requires complications to where if a child has surgery before they're fully developed between 21 and 22, then they have to have more surgeries correct what's going on as they grow, develop complications too, which I'll show you here on these images over here. Our approach to scoliosis is get it checked early. Okay, be a parent that wants to prevent injuries, prevent bracing and surgery, and get it checked early. We do in our office and chiropractors do in general is do postural exams. Again, for our office and our unique office, what we do, because we see enough people, we don't charge for postural exams. We don't charge for those things. We want to make sure you as a parent can be aware and teach parents how to look at their children from a front to back view so you can help hopefully prevent scoliosis, and a side view to see what's going on with their children so you become their primary care physician. You become their primary reason to stay healthy. Okay? In our next video, we'll talk about more in detail of how we check in our office, postural exams with some of our patients that are children, and also down the line we'll check with the x-rays too and walk you through what x-ray shows. Our biggest thing again as parents, become aware that you really have to be more on top of things than the school district will be or your medical doctor will be to make sure they don't have scoliosis that cannot be corrected before they need surgery and bracing. Okay, I hope this is helpful for you. Please share this information with your friends and family, and enjoy health from the inside out, and have a great day.